So an unusual one is a concept that we talk about all the time in clinic, is that where it hurts often isn't where the problem is. And so what I mean by that is that where it hurts, of course, has now become injured. So I'm not saying that there actually is no problem there. There may be a little bit of mild injury there, but actually the author of the problem very often is somewhere else. And so what I might mean by that is that if we have rolled on our ankle perhaps 10 years ago and it's completely healed, what generally happens though is we shift our weight very subtly to the other side. And if we shift our weight very subtly to the other side, what we often find is that a patient may present in clinic and they've actually got a problem now in the left knee. And so having had a problem in the left knee, we need to do two things. We need to sort out the problem in the left knee, but also we need to stop the patient compensating from the old trauma in the right knee. An example of that is we often hear patients tell us that they've been to see a surgeon, and the surgeon has had a hip operation on the right hand side and the hip operation has gone really, really well. But at the time of the consultation, the surgeon says, "Mrs. Jones, we're going to see you again in 10 years because you're going to need the other hip replaced." And of course, the question that you would ask is, well, why would I need the other hip replaced? Because on the x-ray, it looks absolutely fine. And of course, the answer to that is that when we have a problem with one side, we actually shift our weight to the other side to compensate. But very, very interestingly, when we put patients on a gait analysis, what we find is that if you have more weight, for instance, on your right side, we can be fairly certain the reason why you're doing that is either a problem with the left ankle, the left knee, or very, very interestingly, the right hip. And the reason for that is that if I have a problem with the left ankle, the left knee, of course I'm going to weight bear over onto the other side to try to protect the left ankle or left knee. But actually, if I have a problem with the right hip, I'm going to put more weight onto it because of the structure and the angulation of the way the bone goes into the socket. You actually put more weight onto that side in order to try to protect it. And so when we're in clinic, one of the things that we want to do is we don't just want to see where it hurts, we actually want to see where you're positioning to see if you're compensating. So not just where it hurts, but whether you're actually compensating onto that painful area in order to try to take the pressure off something else.